This is my presentation on Myasthenia gravis. My name is Russell Weinbrecht for Kines 1000, and it is May 4th, 2026. Topic overview. We're going to be talking about what Myasthenia gravis is, or MG, why it matters, the history of Myasthenia gravis, the causes and effects of Myasthenia gravis, other various statistics and treatment methods. I don't have the prognosis or the prevention because currently there is no prognosis or prevention, and I will be getting into that as well. So, a quick introduction on myasthenia gravis. It is a chronic autoimmune neuromuscular disorder. You can't see it there, but it says immune system blocks communication between nerves and muscles. That's why on the first slide, I had a little neuromuscular junction, because we'll get into that. It weakens the muscles and weakens their signaling, and it often starts in the face or eye muscles with this droopiness, as you can see here, normal face and eye muscles, and then a little bit of droop on one side. Some of the history of myasthenia gravis is it was first described in 1600s. That's when it was first discovered, and it wasn't named until the 1800s. It was linked to the thymus gland abnormalities. They believe the thymus gland acting out was the reason why this autoimmune disease happened, and the first treatment was developed in 1930s. The autoimmune disease discovery was the 1960s, so they didn't realize that it was an autoimmune disease until that time. And today, more advanced treatment options are being developed and discovered because the treatment options are pretty limited for it. So the causes of myasthenia gravis are autoimmune. It's an autoimmune disorder. So that's the antibodies attacking acetylcholine, which is ACH, which is the main neurotransmitter in the neuromuscular junction and from neurons to muscles. It weakens the nerve and muscle signaling. And something I found on an article was that thymolipoma has been associated in up to 50% of the patients. So thymolipoma has also been claimed as a cause of MG. Some of the effects of MG is ptosis, which is eye drop, diplopia, which is seeing double vision, slurring of speech, difficulty swallowing, and overall weakness. The slurring of speech and difficulty swallowing come with it affecting the facial muscles first. So slurring of speech, not really having full control over the tongue and facial muscles. Difficulty swallowing, same kind of thing. And then overall weakness, it does affect eventually all the muscles in the body, but it starts off with the smaller ones, and visibly it's easy to see those facial muscles. So some of the statistics, it affects about 14 to 20 per 100,000 people. Men is an onset of 50 to 60 roughly. That's just some statistics I was able to find. And women, it's a little bit earlier onset, 20 to 40. It's a pretty rare disease, but because of increasing awareness, we're getting an increase in diagnosis because more people are aware, more people are going to see it to see if they have it, and that's good. A prognosis is currently there is no cure. So you're going to, once you have been diagnosed with it, you're going to be dealing with it for the rest of your life. And the symptoms can be managed, and quite well, depending on the person. Life expectancy is pretty close to normal with interventions, with medications, and with other treatments. However, without medications or without treatments, there's a risk of myasthenic crisis, which is your ventilation muscles becoming weak, like the diaphragm, and supporting rib muscles and stuff like that. Thus, you aren't able to breathe, and so it's a emergency, life-threatening emergency, and you could end up dying. And you usually have to be put on simulated ventilation at a hospital or something like that. Some treatments are limited therapy due to the nature of it being an autoimmune disease, and the more you use your muscles, the weaker they get. It's hard to do therapy because there's a lot of adverse side effects. So there's some medication like pyridostigmine for nerve signals, and prednisone to suppress antibodies, which is antibodies are the immune system. So immune system attacking its own ACH will suppress that and prevent it from targeting those ACH, thus getting the normal signals. And also a thymectomy surgery, which is removing the thymus, or the gland, the thyroid gland, which is, like we were talking about in the history, a reason why people believe that people would get it because of the thyroid gland. Some prevention and management. So there's no real prevention, only management. If you get it, you get it, and once you've gotten it, you just kind of have to try and live with it. There aren't things that you can guarantee do to not get MG. You can try avoiding triggers on the immune system like stress, lack of sleep, other kind of triggers like that, emotional triggers. Medications like the ones I previously mentioned can help your management. Monitoring those levels, if you're getting triggers in your immune system, making sure you're monitoring the sleep levels, monitoring the anxiety and stress levels. And then there's limited but potential therapy, physical therapy routes that you can take to try and get the weakness back. Remove the weakness and get the strength back. So a conclusion and some key takeaways that I want from this presentation is to know that it's a chronic autoimmune disorder. Once you've got it, you've got it. There's only living with it. It's specifically about muscle weakness with the ACH and the signals between the neurons and the muscles getting interrupted. It's treatable, but it's not curable. And early diagnosis is key to having a long and fulfilling life. And a long and fulfilling life is possible. However, the main thing that I want you to be scared about is the prevention of myasthenic crisis, which is a life-threatening crisis that could happen with the ventilation muscles like the diaphragm and supporting rib muscles and throat muscles becoming too weak to be able to breathe. So these are my references, and thank you.